This advising government say the lower the cases can get, the better. We're likely to find out more later this month when the Prime Minister lays out a roadmap of lockdown. Dr. Deepti Gurdasani is a clinical epidemiologist at Queen Mary in University of London. Good evening to you, Deepti.
Good evening.
Good evening. So our numbers starting to go back down, but where do we need it to be and for how long?
Yeah, I mean, it's really good news that cases are coming down, but we need to remember that case numbers are still very high. 1 in 80 people are still infected, and hospital admissions at this point in time are still higher than they were at the April peak. So there is a long way to go. We need to get infections to a really, really low level to prevent what's happened the last 2 times we locked down and released. If we release too early, there's no reason we will not see another surge of cases soon, given that vaccination will not actually prevent transmission, as only about 20% of the population has been vaccinated so far.
How much does it need to be?
The truth is that we don't know, and we don't even know whether it is possible to reach herd immunity through vaccination, because we don't know what the impact of vaccination is in reducing infection and transmission yet, particularly with new variants that are circulating. So the truth is we need to treat vaccination separate from transmission, and we need to bring transmission down and keep it low with the usual public health measures, which is restrictions followed by a good test, trace, isolate and support system, safety measures in school, and good quarantine at borders.
When you say safety measures in school, are we even close to opening up schools?
Yes, I'm really worried about this because schools were actually closed because they were contributing a lot to community transmission within England. And now we look like we're planning to open up schools, but without changing anything. And we're expecting that things will be different without changing anything. I think we urgently need to put in those safety measures before schools open. Otherwise, we will once again see that surge in transmission in children and then in the community.
How careful do we need to be? For how long? Like, are we going to need to be this careful for years? As in this year and into next year? Or are we
I think it completely
away or what?
depends. I think it completely depends on the government strategy. So if the government chooses to go for an elimination strategy like Australia and New Zealand have gone for, we could be to a near normal place within 4 months, but with border restrictions. On the other hand, if the government chooses a strategy whereby we start lifting restrictions quite soon before bringing transmission down, I think it's very likely that restrictions will need to continue for years.
For years?
Well, potentially, because, we know that the virus is adapting and, we're trying to get our vaccines to keep up with the virus. We still don't know what level of vaccination we need to really suppress transmission. And we need to remember that children are not licensed to take the vaccine yet. So even if it does have an impact, it's possible we won't be able to vaccinate a large proportion of the population. So it's very likely that virus transmission will continue and outbreaks will continue to happen even with vaccination, which is why we need to focus on transmission elimination in parallel with vaccination.
Dr. Mike Tidsley, listening to this, works in the field of mathematical epidemiology at the University of Warwick. Let's talk numbers, Mike. What do you make of today's coronavirus figures?
Well, I mean, things are moving in the right direction, Stephen. And I think this is certainly good news. I mean, I do agree that we do need to be really careful, that we don't want to relax things too rapidly, because if we do, we're likely to get a resurgence. I do want to pick up on one thing about schools, however, if I may, because actually the evidence suggests that really the schools aren't contributing significantly to community transmission, particularly primary schools. Secondary schools slightly more so. But I think there certainly is an argument that maybe in a few weeks we could cautiously open primary schools as these numbers are coming down, but it needs to be very much a stepwise approach back to normality and not opening up too much too soon to avoid this resurgence that we are really worried about.
Yeah, but it's the pressure, isn't it, that's on the government to get as much open as soon as possible. Like, that's where it's at. People are sick of this.
Oh, absolutely. I mean, we're all sick of it. I mean, I think this is the thing. We get quite a lot of flack as epidemiologists, Stephen, for saying, we want to stay in lockdown. I think none of us want to stay in lockdown. The danger is, and the thing that I'm really worried about, and I particularly feel about this with schools, I feel so sorry for all of our school children who've been out of face-to-face education for so long. My worry is if we go too quickly and we get a big resurgence, then schools will have to close again. And that's the really concerning thing. I really hope that, by the summer we can have some level of normalcy, but in order to get there we need to go really slowly and step out of it and let the vaccination sort of keep up with the relaxations so that, we're not undoing all the gains we get from vaccination by opening too quickly.
Yeah, but you say that. So let's say we stay in some type of intense lockdown and we open up in the summer, whatever it is, and then a new variant comes from some other foreign country and the vaccine maybe doesn't cover that or the efficacy isn't as good, and we're back again to more restrictions. And I know my question is simplistic, but I do think it is one on many people's minds. When the hell is this going to be over?
Yeah, and I mean, this is a really good point, and obviously is something we're worried about. In the long term, we may have to live with something like this for a really long time and have, say, vaccination programs every year if we get new variants coming in so that they can protect against whatever's circulating. It will come down in the longer term to getting these cases and these number of deaths down to really low levels. We have to remember, of course, Stephen, we live with seasonal influenza every year. We get people dying from seasonal influenza. And in a sense, we sort of accept that as society. Now, of course, what we don't want is, thousands of deaths every day from COVID. That is something we really want to avoid. But we need to think long term. How are we going to manage this virus and what level of controls are we prepared to put up with in order so that we don't get big resurgences?
Well, how do the numbers compare with deaths each year for flu compared to COVID this year? How big's the gap?
That's a really good question, and I, to be honest, I don't have the figures on top of me. But I mean, we are significantly higher. I think it's not a comparison I was trying to make on a numbers basis. I mean, we have had many more deaths from coronavirus last year, for example, than we would get from a typical year with seasonal influenza. But if we were to get our, say, daily numbers down in the winter, say, below 50, for example, per day, that's probably comparable with what we get from an awful lot of other causes. So this thing, we're clearly, we're naive if we think we're going to eradicate this. We're just not. And so what we need to do is really get on top of this and get the incidence down to a low enough level that effectively we can manage it with a low level of controls.
Sorry, can I cut in there?
Yes, of course.
Well, first of all, I want to say that we have about 7,000 to 15,000 deaths from flu every year. But I also want to say I'm a bit worried about this rhetoric about just focusing on deaths. I mean, we know that most of the critical care admissions are actually under 70 years. Most of the cases are well below that. And we know that many people suffer from long COVID. So 10% of people who get infected have long COVID, which we don't fully understand. So they have symptoms lasting for more than 12 weeks, including in children. So the idea that we accept a certain level of deaths and morbidity of a disease that we don't understand, which will also potentially lead to virus adaptation, which has already happened and threaten our vaccine response, over the idea of elimination makes no sense to me, given that there are many countries that have...
We're not going to be able to eliminate COVID, are we?
Why don't you think we'll be able to eliminate COVID? Actually, it's much more likely that we'll be able to eliminate COVID, which is something other countries have done, than achieve herd immunity with vaccination.
Well, they have up
so
to
far
now,
there isn't
Deepti. You're the clinical epidemiologist, you tell me, but they've eliminated it. You're talking about the likes of Australia. But they've eliminated it so far. But, of course, it could come back at any time in any country, especially when borders are open again, especially when people start going on holidays again. The long term is, I thought what you experts were telling us was the long term is we're going to have to live with COVID. It's here to stay now.
Well, I mean, I'm really concerned that this is what a lot of the scientific community in the UK seem to be saying, when there is another strategy with less uncertainty associated with and far more evidence behind it than the idea that we live with it and accept a level of deaths and morbidity from a disease that we don't understand fully. And the potential for virus adaptation that we've already seen, which can render vaccines less effective or even ineffective over time.
But we do that with most diseases, don't we? We've got to live with most diseases, and there's a certain mortality rate associated with all of those diseases. I don't understand.
That's absolutely true, but this disease has caused more than 100,000 deaths in 1 year. This is a highly transmissible virus with a high infection fatality rate. You cannot compare it with the flu. Yes, we do live with many diseases, but if a highly contagious and highly fatal disease arrives, then you can't live with it, because unfortunately most people will not be able to live with it, and even the people who live with it will suffer long-term effects that we don't fully understand yet.
Bob Blackman, Conservative MP for Harrow East, listening to this tonight. Good evening to you, Bob.
Good evening.
Good evening. So where do you stand on this, and where do you think the majority of your party stand on this? Are you prepared to be patient and go for a harsher, longer lockdown, or is it close to time, Bob, to take the risk and open up as much as we can?
Yeah, I think we've got to take a balanced approach to this. Clearly, we've got to be cautious. I mean, anyone that says go through this long lockdown and then rush out of it and go back to normal would be delusional. So we've got to be progressive in it. I think what we're all looking forward to is the Prime Minister setting out milestones on what's got to be achieved by to allow further easing of the restrictions. So, for example, we want to see the schools back in operation. We'd like to see the schools back in operation at least partially by the 8th of March, which might be primary schools going back. It might be particular year groups at secondary level going back. It could be that young people go back for 1 or 2 days a week in rotation. But at least we get the schools back. And then after Easter, to see them back in full operation. For example, we want to see various different aspects of the economy opening up. Because after all, what we should remember, when we entered lockdown originally, going back to March last year, which seems like an awful long time ago, the first thing was to obviously suppress the spread of the virus, not to eliminate it, but to suppress it and actually take the pressure off the National Health Service. So what's going on now is obviously the success of the lockdown is that the transmission rates virtually everywhere are going down, the level of hospitalisation is going down, and the level of deaths are going down. But you'd expect that because basically no one's been interacting socially at all. So given that this passes from one person to another, but if you eliminate or reduce down the amount of social contact, that's bound to happen. So it's got to be cautious, but it's got to be progressive.
I'm going to broadcast an interview later on tonight, after midnight actually, with the Chief Medical Officer of Northern Ireland, and he was talking about specifically Northern Ireland, but it was broad enough that I think it'll interest everyone across the UK. And one of the things that Michael has told the press this week, you're talking about schools reopening. Now, this is the Chief Medical Officer who talks, obviously, to the other 3 CMOs across the UK on a weekly basis. And Michael McBride said, reopening schools will certainly add significant upward pressure on the R number. The increase could be between 10 and 50%. And it all depends how schools are reopened, when they're reopened, and what mitigations are in place. So we've got to be very, very careful about this understandable push to open schools if we're trying to keep the R number down.
Yeah, you're absolutely right. But there's a number of key points. One is young people are less likely to suffer badly from COVID. No, we know that. That's one of the things.
Doesn't mean they're less likely to spread it.
No, but the fact is they're less likely to suffer from it. Now, as the vaccination rate increases, and we're well on track now, that by the end of the week, this weekend, we'll be in a position where the top 4 categories will have almost all had at least their first dose. Many have had their second dose, and then we're moving on to the other 5 major categories of people who would suffer badly if they caught COVID. That should be completed, and it's going very well. That should be completed by the end of March, the way things are going. And then we can move on to younger people to get them vaccinated. So it's all about the progress of vaccinations. What we do know is that when people have been vaccinated, even if they suffer from a degree of catching COVID, then just having the first dose reduces down the likelihood of being seriously ill and being hospitalised. So we're starting to make a lot of progress on that, and I think that's key. But if we don't get young people back to school, particularly primary schools, then there's going to be problems about the teaching and learning. There'll be problems about people going back to work, and reopening the economy will be very difficult indeed. Plus, of course, there's all the mental health problems that are coming.
Mike Tildesley, would you support opening schools anytime soon?
Well, I think certainly, I think we need to be careful, but I do agree. I think there's an argument for primary to open sooner rather than later. We know that with primary schools, I mean, the data are actually very clear on primary schools, that the risk is so much lower. We weren't seeing a strong contribution to community infection in primary schools. And it is a lot harder for younger children to engage in online learning than it is for slightly older children. So certainly I think a staggered approach to opening schools, starting with the youngest age groups, I would say probably by around about the government date of the 8th of March, we could potentially be in a position to send our youngest children back to school and then take it stepwise from there.
I mean,
Do you agree with that, Deepti?
One of the big
So
risks
I'm really concerned with the idea that
mixing outside school gates. That's one of the biggest problems.
I absolutely agree. Yes,
okay. I don't agree with this idea that primary school children don't contribute importantly to transmission. Actually, there's a lot of evidence that supports this, including evidence from the ONS that suggests that between April and November, primary school children were 2 times more likely to bring infection into an household than an adult, and 2 times more likely to transmit to members of the household. So it's very clear that they do contribute to community transmission. And the idea that, we're going to open schools without any mitigatory measures, any additional mitigatory measures, and not see the surges we saw before, to me is really unrealistic. So I would say we need clear mitigatory measures outlined right now and a long-term strategy.
Sorry, go ahead, Bob. I think you were trying to come in there.
Yeah, I think one of the problems here is that if we're going to say to people, we're not going to open the schools, we're not going to open up the economy until we've eliminated this disease and the transmission of this virus and suppressed it forever. I mean, it's not realistic. And
but I'm not saying that. I'm saying put mitigatory and safety measures in schools before you open them. I want to see mask use. I would like to see air filtration, ventilation devices with carbon dioxide monitors.
So you want young children in primary schools wearing masks?
I would like to see them encouraged to wear masks, as they are in many other parts of the world, including in Europe. This is not something new. And I would like to say air filtration devices, air purifiers in schools with carbon dioxide monitors that meet the standards of the CDC. The CDC also recommends that primary school children wear masks. I would like to see that. Because all of this is in line with current evidence.
Don't agree with this. We are not seeing outbreaks in primary school children in schools, and that is very, very clear. We've been working on the absence data from schools from September through to December. We just don't see it in the data. So actually, I agree with what's been said. It's more the risk of the other types of mixing that happen when schools open. It's not the school environments themselves that are risky in the situation.
The Public Health England surveillance data shows an equal number of outbreaks in primary and secondary schools consistently. And right now, the outbreaks in primary schools are higher because the attendance in primary schools is higher.
I'm talking about. Can you just tell me? Sorry, you're obviously a medical professional. I respect that. How many children from primary school age have been admitted to hospital with suffering from COVID?
So I can tell you the data from primary and secondary schools. There have been 1,300.
No. How many children from primary schools have been admitted to hospital suffering from COVID?
But that's not. See, that is a different point. It's about whether children get ill. I'm talking about whether children can transmit to others in the community who can get ill. Those are two separate questions.
You're basically saying that no one should mix with anyone at all, ever.
No, that's not what I'm saying. I'm saying put safety measures in schools. I'm saying open schools with safety measures. How is that saying nobody should come into contact with anybody else? I didn't say that at all.
Well, because what you're going to be saying then is we're saying primary schools should open and secondary schools as well. We're going to be talking about employment circumstances reopening. And so if you're going to place restrictions like that on young children, what sort of restrictions are you going to place on employment environments?
I'm talking about making school environments as safe as workplaces. Children can get long COVID. Between 12 to 15% of children infected have persisting symptoms after 5 weeks. Do you really want to expose children to that risk when you don't understand the long-term consequences of this?
But the key is, are they suffering?
Yes,
badly?
They are suffering. It's very clear they are suffering.
So how many have been admitted to hospital? You're suffering from COVID.
So you're saying that them suffering from long COVID doesn't matter if they don't get admitted to hospital?
If they're seriously ill and have been admitted to hospital.
So it's okay if they're dysfunctional. It's okay if they're not functional if they don't get admitted to hospital. It's okay if they transmit to their parents and other vulnerable individuals in the community. That's fine. Is that what you're saying?
No, I'm not saying anything. I'm challenging the position of people suffering very badly from this, so much so they have to be admitted to hospital. Because that
you're challenging the positions that you're challenging the position that schools should be made safer to protect children, teachers, and the wider community. That is the position you're challenging right now.
What I'm saying is what measures have to be taken to make sure that it's not life-threatening. And the fact is
I'm
that people
absolutely
suffer
saying
from all
that.
sorts of diseases and all sorts of childhood diseases.
So I'm
they're in
saying the
school.
measures that we need to take are the ones in line with CDC and WHO guidance. And what I've laid down is very much what the CDC and WHO guidance suggests, even for primary school children. Yes.
Are you saying, Deepti, that 12 to 15% of children infected have long COVID? Is that what you're saying?
Yes, I'm not saying this based on anything that I'm saying. It's based on the ONS data that's been released on children that shows that 12 to 15% of children have ongoing symptoms after 5 weeks of COVID infection.
And that's Office of National Statistics data?
Yes.
I am gobsmacked by that.
You can look it up. It's right out there.
15%.
Yes, 1 in 7 primary school children and 1 in, or is it the other way? 1 in 8 primary school children, 1 in 7 secondary school children. Yes.
And what are the symptoms?
What are the symptoms? They're a combination of things like cough, shortness of breath, palpitations, fatigue. Yes.
Mike Tinsley, did you know this?
You're saying that 1 in 7 children have suffered from COVID?
Have suffered from long COVID. So
hang on, wait a minute. What sort of level of infection are we talking about amongst children of school age?
The current prevalence among school age children is 1%. So 1 in 100 children currently in the UK have infection. Of the children who have infection, 12 to 15% have persistent symptoms after 5 weeks. This is all from the Office for National Statistics.
So we're saying, so we get the facts here. So 1% of children have suffered from COVID, and of that 1%, you're saying that 10 to 15% have suffered from long COVID. So
yes,
what we're saying
1%
is a very small percentage of young people.
Do not misquote me on this. 1% of children today are suffering from long COVID, okay? The prevalence, so that means today 1 in 100 children in the UK have COVID, right? Of that percentage every single day. So this is on one day, 12 to 15% will go on to develop long COVID. If you look at the numbers of children infected, they're huge. They're in the millions.
Sorry. I it's just the first time I've heard this. I know you're saying the statistics are available, and I'm going to go and look at these statistics tonight when I'm in bed after this show because I find
I'm
it
happy to send
interesting.
Them to you.
Well, please do. I find it interesting. I find it gobsmacking. So in this country, you're saying that there are millions of children infected, and you are saying that the ONS data would state that 1 in 7 of those children infected will suffer long COVID.
Yes, that is what the ONS data says, and there are millions of children who have been infected, yes.
So if there are millions of children who have been infected, then that would suggest, do you know how many million?
No, I don't know how many million have confirmed infection from primary school. I know that the prevalence has been...
But that would suggest that we have at least hundreds of thousands of children in this country with long COVID.
Well,
I've just looked at that ONS statistic, and it seems to claim that actually about 500,000 children have so far been infected with COVID. So, but your statistics would claim that actually it's about 70,000 that would have been suffering from long COVID. So it's way below the several million that you've just said.
So just let me clarify, 500,000 are confirmed cases. So you will find that children are much less likely to have symptoms. So if you look at the ONS data, you will see the prevalence in children throughout this. So particularly through October, November has been 2 to 3%, which is much higher than in other age groups and suggested by the confirmed cases. And the ONS data includes asymptomatic and mild cases as well. So the 500,000 that you're talking about is a huge underestimation because it's based on symptom-based testing.
And so, Deepti, you're saying that you believe, and the data would back you up. Is your view that we have hundreds of thousands of children in this country who will have long-term symptoms like what?
Long-term symptoms like chest pain, breathlessness, cough, exhaustion, gut symptoms. The ONS has a list that they collect data on, and all of these symptoms, one or more of these symptoms persist in children for more than 5 weeks. in 1 in 7 to 1 in 8 of children who get infected. And these are children, including children with mild and asymptomatic infection. So they don't need to meet the criteria that you're talking about of symptom-based testing.
Because I'll tell you what, this isn't high up the news agenda. It should be.
I agree.
Because parents listening to you tonight, they will look at that ONS data, and Dr. Mike Tilsley, I'll tell you what, if this data is robust, and if there are hundreds of thousands of children in this country with long COVID, that puts a completely different perspective on opening up the schools before they're vaccinated, doesn't it?
Well, I mean, in a sense it doesn't, because actually this is slightly tangential to whether actually there is a risk of large-scale infections within schools. I mean, this is the whole thing with children that are reported. We actually don't know where they're infected. And I think we need to be a little bit careful of attributing cause and effect here. You know, if we are seeing a significant number of children being infected, you know, and we are seeing a significant number of them being, suffering long COVID, you know, that's obviously a concern. But actually, that doesn't mean that schools are risky environments, and that's where we need to be really careful.
We know that the R rate has. We know that the R rate. Well, the chief medical officer in Northern Ireland, he's the guy I would speak to most often than any other CMO. In fact, I haven't spoken to any other CMO, and he has told me that he believes schools being open contributes somewhere between 0.2 or more to the R rate. It's there. He's given an interview this week to say it could contribute 10 to 50%, for goodness sake.
Giving it as a percentage, though, is a bit misleading, because actually giving it as a percentage, it highly depends what your baseline R rate is. You know, 10% of 0.7 is very different from 10% of 2. So we need to be a little bit careful with that. I think it's true. I mean, clearly it does contribute to the R rate, but any form of opening contributes to the R rate. I'm not saying that no infections will happen in schools, but that not a disproportionate number of infections are happening in schools compared with any other reopenings of society. And that's where we need to be a little bit careful.
And that's why I'm arguing that the same safety measures that we have in other parts of society should be in schools. It's very clear that primary and secondary school children, the infections have tracked with school openings and school closures and with half term, suggesting that there is clear transmission happening within schools, even in primary schools. This is not just data from within England, but in many different parts of the world. But clearly in England, we see this in primary school children. And outbreaks also track with primary school children.
And what is there not in a lot of classrooms throughout the UK? Ventilation. What is there not in a lot of these classrooms? They're not designed to be 2 meters apart with 30 kids in a class. You start talking about primary schools. What do kids do? They interact. Of course they do. Yeah. That's what children do.
And the UK class sizes are actually bigger than the class sizes in much of Europe. And in the Department for Education guidance doesn't actually put a cap on bubbles. Currently, we have schools with bubble sizes of up to 300 children, which is not a bubble at all.
Bob, are you concerned about this?
Well, I'm amazed when I hear this information coming out, because it's certainly the first time that I've heard such information or such data and such claims. I mean, the reality is that, yes, we've heard about there being isolated cases in schools, which has meant either that year groups or that schools have had to close. So we've heard that during the height of the pandemic, really, effectively, and certainly there's a risk. There's always a risk with everything, but there's a risk that children can transmit the disease to parents, and particularly to older, to grandparents and such like, which has been one of the issues of concern that we've had. But in terms of young people suffering badly, all the information I have is that young people are not, if they catch the virus, they don't suffer badly from it. Then basically, the older you are, the more likely you are to be seriously ill as a result of catching the virus. And then the younger you are, the more likely it is that actually you might have the virus but not really realise it, or it might be a bad cold, and it might be not so serious. So if doctors now are saying, actually, that's not the case, then they better come forward very quickly and say that.
I think doctors have been saying that for a long time. I'm actually astonished that people here are commenting on this without actually being aware of the evidence around what's happening with children with long COVID and the evidence of transmission across children.
I've got to go to the news tonight.
I've been working on the absence data from schools right the way from September. I've been working very closely with SPI-M and the Department for Education on this, and this is the data I'm reporting on. There is no evidence of large-scale outbreaks in primary schools. So
you are aware of the ONS infection household survey, right?
Absolutely.
And, but, so you're aware of the evidence that children are 2 times more likely, or in England, to have brought the infection into households, and 2 times more likely to transmit than adults to members of the household in primary schools. You're aware of this?
I would say that you should never quote single numbers, because there is always uncertainty around these. So saying twice as likely is extremely dangerous, and these are the kinds of figures that get pasted all over the press. So I would be really cautious about saying that.
Okay, but you are aware that prevalence in primary and secondary school children was the highest across all age groups in November, around 2 to 3%. You're aware of that as well, including in primary school children.
This was a feature of the new variant, because children were mixing more in November than other parts of society, because the rest of society was under lockdown. But if we then track forward to December, that was filtered across all age groups. So it was not indicative of schools being open per se, but the fact that everyone else was in lockdown.
But clearly children were spreading to each other, which is why the prevalence got so high among children, and was tracking half-term as well. So when half-term happened, primary school infections dropped. How do you explain that?
Primary school infections were not rising significantly before that. I mean, the data clearly showed that actually, if you look at primary school cases from September, they were very much tracking rises in cases in the community. And in fact, if you look at the tier statuses, schools that were in areas where they were in higher levels of tier status, cases were actually falling, because it was mirroring what was happening in the community. So, this is very clear.
But they were very high in November alongside secondary school children, and we see a dip at end of October and half-term, which SAGE has also attributed to school closures in primary and secondary school children. So how is this happening if there is no transmission or little transmission happening in schools?
I have got to go to the news tonight, but I want to ask one final question, because I'll tell you what, Deepti, you've now kept me up all night. I'm going to be... This is my nighttime reading at 1 a.m. in the morning. I'm going to go and I'm trying to find this. You're going to send me this data, Deepti, is that right?
I've done my job. I will send it to you.
You're going to send me the data, are you? Where can we all find this data? How can we find it? Where is it?
You just have to look at the ONS survey and the ONS household survey. But I've written a really good Twitter thread on this, which I can link you to. Okay.
And final question. You say that of children who get infected, 1 in 7 will suffer long COVID. Can you make the comparison for me, please? What does the data suggest in terms of adults? What proportion of adults who get infected have long COVID?
So it's similar. It varies between 10 to 20% depending on age group. But it's quite similar.
10 to 20%?
Yes.
Right. I need to read this and do this all tomorrow night. Deepti, thank you. Mike, thank you. Bob, thank you. Sorry we're late for the news, but I wasn't leaving this. Pick up the phone, 08085 909 693. Here comes the news from 5 Live at 20 to 11.